Hello and welcome to This Explainer. If you are a caregiver for someone with dementia, well, you already know it takes a truly monumental amount of patience. But let's be honest, there is one specific behavior that can push even the most dedicated, loving caregiver right to the absolute edge of burnout, and that is repetitive questioning. I mean, hearing the exact same question asked 20 times in a single hour, it's exhausting, it's draining. So today, we're diving straight into the clinical research to figure out exactly what's happening in those moments, and more importantly, how you can respond in a way that brings a little more peace to both of you.
It is literally the most natural question in the world for a frustrated caregiver to ask. Why do they keep asking the same thing? First off, I want to completely validate that your frustration is normal. You're human. But here's the critical shift in perspective we're going to explore today. Ready? Repetition is often just a way of communicating an unmet need. When words fail, their behavior speaks for them.
Okay, here's how we're breaking it down today. 1. The reality of repetition. 2. Decoding the behavior. 3. The response sequence. 4. Respectful communication strategies. 5. Safety and medical escalation. And finally 6. The limits of medication. Let's get right into it.
Section 1. The reality of repetition.
A repeated question is, clinically speaking, simply an observable behavior. It is not a diagnosis on its own. And this is absolutely crucial. It is not a deliberate manipulation. The research strongly emphasizes that we have to view this strictly as an observation. We can't jump to the painful conclusion that they are doing it quote-unquote on purpose just to annoy us. They really truly aren't.
We need to separate helpful assumptions from the unhelpful ones. Repetition might mean impaired recall, it could be anxiety, confusion about time or place, or an unmet physical need. What it is definitely not is a deliberate attempt to annoy you or proof of some massive hidden emotional crisis. Also, and this is a big one, it's not a guaranteed sign of a urinary tract infection. While infections can for sure cause behavioral changes, infectious disease experts caution against automatically labeling a single behavior, like a repeated question, as a UTI if there are no other physical symptoms. We have to look at the bigger picture.
Section 2. Decoding the behavior. Before we start looking for clues, we have to ground ourselves in the practical science of dementia. The person may not retain the question, the answer, or the conversation at all. Now, caregivers often wonder, is the issue how the brain encodes, stores, or retrieves the memory? But the practical reality we just have to accept is that they simply aren't retaining the interaction. Once we accept that, we can stop trying to force them to remember, and we can start looking for the actual trigger.
So, what are those triggers? Well, consider the possibilities. Is there a change in their routine? Maybe an upcoming appointment is causing some anxiety. Are they fatigued from a bad night's sleep? Could they literally just be hungry, thirsty, or dealing with constipation? What about the room? Is the TV blaring, causing a sensory overload? Or could they be in pain? Remember, these are possibilities for us to gently explore, not conclusions to loudly announce to them. The exact same person might repeat a question because they're hungry on Tuesday, and then repeat that exact same question because the room is too noisy on Thursday. It's like being a compassionate detective.
Section 3. The response sequence.
Okay, here is a highly effective clinical sequence that you can use right in the moment. Step 1, pause and approach calmly. Just check for immediate safety. Step 2, give one short, truthful answer. Do not argue or say, "I already told you." Step 3, acknowledge the likely emotion they're feeling. Step 4, explore those hidden contributors we just talked about, the hunger, the pain, the noise. Step 5, trial one practical support, like pointing to a visible clock or a really simple written note, but only do this if it doesn't cause them more confusion. And finally, step 6, redirect gently to a pleasant, safe activity. Now, will this stop every single episode? No, but it gives you a clear, calming anchor when things get overwhelming.
Section 4. Respectful communication strategies.
Let's look at some exact phrasing recommended by dementia care professionals. Try this. Lunch is at noon. I will tell you again when it is closer. This is a real game changer. It works so beautifully because it's brief, it's truthful, and it doesn't invite an argument. Even if they ask again 3 minutes later, you can calmly deliver this exact same short, reassuring fact. It totally takes the pressure off of you to invent new answers or test their memory.
And here is another incredibly powerful one. You are safe with me right now. If the repeated question stems from anxiety or maybe confusion about where they are, this directly addresses the underlying emotional need.
It acknowledges their fear, but it doesn't rely on false reassurances or fabricating some elaborate, untrue story about their situation. It's emotionally responsive, and it's just deeply respectful.
To round out our communication toolkit, you'll want to keep these do's and don'ts in mind. Always use their preferred name and speak directly to them, not around them, as if they aren't in the room. Absolutely no baby talk, no shaming, and please, no testing their memory with questions like, "Don't you remember?" You also want to avoid rapid-fire explanations. Just keep it to one idea at a time. And when you offer choices, use simple yes, no, or two-option formats, but, and this is key, only if those choices are genuinely available to them in that moment.
Section 5. Safety and medical escalation. Now, there is a hard boundary where our behavioral detective work stops and emergency medical action begins. If you see sudden facial droop, one-sided weakness or numbness, new difficulties with speech, sudden trouble seeing or walking, loss of balance, or a sudden severe headache, this is a medical crisis. These are the stroke warning signs outlined by the CDC. If you see these, you must override any behavioral management strategies and call 911 immediately. No exceptions.
Short of a 911 emergency, what about sudden behavioral shifts? Well, if a person experiences a rapidly fluctuating change from their usual thinking or alertness, they need urgent clinical guidance. This isn't just a bad dementia day. It could be delirium triggered by dehydration, an underlying infection, or a bad medication interaction. You simply cannot self-diagnose delirium from a behavior alone. It absolutely requires prompt professional assessment.
Section 6. The limits of medication.
When you're absolutely exhausted by repetition, it's so natural to wonder if there is a pill that can just make it stop. But we really have to manage expectations here. Non-drug strategies, like the communication and environmental adjustments we've been discussing, these are the recommended first-line management tools. Medication should never be used just to suppress repetitive behavior. In fact, the AGS Beers criteria, which guides medication safety for older adults, strongly cautions against using antipsychotics for behavioral problems unless very strict criteria are met and all non-drug options have failed. Basically, pills are not a routine fix here.
Let's pull all of these clinical takeaways together, shall we? Repeated questions often reflect impaired recall or anxiety. Don't just infer a single cause. For communication, your absolute best tools are a calm tone and brief, truthful answers. Any sudden or fluctuating behavioral changes require medical assessment. Don't just try to ride those out. And finally, medication is not a behavioral suppressant. It requires very strict clinician review.
Ultimately, managing repetitive questions isn't about fixing the dementia. It's about shifting how we respond to it. By stepping out of our own frustration and stepping into the role of a compassionate detective, you can change the dynamic entirely. So I'll leave you with this. The next time that exact same question repeats for the 10th time today, what unmet need will you discover? Thank you so much for joining me for this explainer, and sincerely thank you for the incredible, difficult caregiving work that you do every single day.